let's talk about this concept of talking about feelings because it's
Mhm.
hard, right? You might say, well, I'm not a psychologist, I'm not a guidance counselor, I'm not a social worker. How do I do that? And the thing I most encourage you to do is to think about when you are with a friend and your friend has in the past listened to you talk about a problem. How was that friend helpful to you? Did your friend immediately jump to problem solving and be like, no, no,
Mhm.
no, you shouldn't feel that way. Let me tell you what you should do, blah, 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 blah. And, or does that friend listen to you and empathize and tell you, I'm so sorry this is happening. That's so hard. But it makes me think of other times you've been there or you felt that way before, but you just sit with the feeling. You talk about it and you sit with the feeling because often behind a feeling, you typically let I don't know from a teenager, right? How you feeling? I don't know. Or from a kid might be like sad and that's it. And you don't get beyond that. So labeling a feeling, what it's about, what is that experience like, sitting with the feeling. So if a child's crying, you just sit there and let them cry till you get to the point where you know that you can move to the problem solving. But that needs to come much later. We really need to sit with the feeling and have our child know that we're there for them and then pick a time to then get into problem solving. But I encourage you to say to yourself, listen, just listen. And if you need to count, if you need to look at the clock, if you need to do something external to give yourself a cue, but listening is so important. So let's divide resistance into if this has been going an ongoing problem versus this is a new problem. If it's a new problem, this is really a way of your child's communicating feelings, just not knowing how to say it. So rather than saying, I'm scared about going to school, or I'm scared I'm going to get COVID, or I'm scared I'm not going to see my friends, what comes out is refusal or resistance. So once again, we go back to the talking about what it's about. And I'm going to parallel this to a fever. So let's think about, as parents, we have all had children with fevers. Do we immediately treat the fever or do we try to figure out the cause to the fever? So is the fever coming because the child's teething, which is a natural process, and maybe you would give some Tylenol, some Advil, or some ice? Or is this an indication that there's a serious ear infection, or maybe they have appendicitis, something serious, but you don't want to just treat the fever without knowing what the cause is. So understanding what's behind the refusal, I think, is very important, which we go back to the sitting and talking about feelings. With younger children, they have a hard time identifying feelings. So they don't know. They're just scared. So then you might need to offer a couple of options. Is it this? Is it this? Is it this? Sometimes children work best if you're giving them a few options to work with. But we go back to the listening what's going on. And oftentimes, refusal that comes off as a very combative or angry refusal often is the outside layer of hurt, depression, sadness. So we want to see if we really can cut through that anger and figure out what really is feeding that fever or that anger and what is the sadness about and can we do to address it. So if the child is fearful that they're going to get COVID, then that's one kind of conversation. If the child is upset because their best friend's not going to be there because their friend's going to be online instruction and they're in person, that's a different conversation. And if the child is overall just scared because it's a brand new school, that's a different conversation. So we really want to understand where to take that conversation to. Ultimately, if we really have such entrenched resistance or refusal and we need to get some assistance, I think that's the next step. Either reaching out to the school in terms of what resources they have, what ideas they have. Oftentimes, working out a behavior plan between the family and the school can be something helpful, like a point chart, and the teacher writes something at the end of the day, or there are many ideas, but basically you want to connect with the school and figure out some plan to figure out how you're going to help address the refusal to school and take baby steps on that. After all, families are units, right? So what one family member has going on has an impact on the other family members. So we're not isolated people living under one roof. Recognizing where we're at and how we are prepared to handle a situation is important. So if we're stressed to the max and our child is stressed to the max. That might not be the best time for that conversation about feelings, or that situation of let's problem solve and figure out a point chart and let's get over and you got to go to school. We want to be able to problem solve when things are calm, when we're calm, when the kid is calm. Because if not, those conversations are not going to go anywhere. So sometimes we need breaks. The situation is pretty heated and you might not know how to handle it. And you might not need to say, I need to walk away and think about what we're going to do next. In the meantime, this is what I expect of you. And you might want to just do something as simple as I need you to read quietly in your room or something that I wouldn't say, and you've got to go be online for the next 8 hours. And then figure out and sort out how we feel about what's going on and what's going to be our next approach. And sometimes we really need help with somebody else, a spouse, a sister, a best friend, a teacher, a guidance counselor, to help us think through the problem if it has become pretty severe. And in some situations, communicating with the school's resource officer might be an option. For those I had mentioned earlier, for those pretty ingrained school refusal that had been going on for months and months and months and are just getting worse and not getting better. And ultimately, at some point as a parent, you know your child best, you know your strengths and limits, and you might need to make a decision about reaching out for professional help.